All right, we're going to go ahead and get started here in this webinar. Just a second, let everybody kind of get settled in here. But I'm Dr. Thomas Clark, and I'm here at the Center for Weight Loss Success. We're doing this live webinar today, talking about how to lose 70 pounds or more, and we say record time, but really it's keep it off for life. So we're going to switch over here to these slides. Hopefully you're all with me now, and I'm going to be able to switch this over. So give me a second to switch these. Here we go. All right. Hopefully you all are looking at what I am looking at, and we will get this started. So yes, how to lose 75 pounds or more in record time and keep it off for life. All right, again, this is Dr. Clark and at the Center for Weight Loss Success. And if you have questions during this webinar, don't hesitate to type them in. We'll get them as I'm going through all this. I may or may not see them coming through, but at the end, I will be looking at all the questions and we will address them. But if you think of them, don't hesitate, just type them into the chat room. Hopefully you've got that there. But let's go ahead and get started. So who is this webinar actually for? Basically, if you need to lose 75 pounds or more, if you struggle to drop the weight, this is for you. If you're worried about increasing weight-related health problems, if you're living in constant pain, or if you're not living that active lifestyle that you dream of and it's related to your weight, this webinar is for you. And if you've, especially for you, if you've ever felt like you just don't fit in, if you're looking in the mirror and what the mirror is reflecting doesn't match who you truly are, if you're tired of taking just way too many medications, if you're just not able to enjoy life's simple pleasures, this webinar is for you. There is a solution, and this presentation really could change your life. So over the next 55 minutes or so, and we can spend as long as we need, but the next 55 minutes or so, you're going to discover some of the best ways to determine if weight loss surgery is right for you. You'll also get to see a few thousand, or a few of our thousands. You won't be able to see thousands, we'd be here all night, but a few of our thousands of success stories and kind of looking at what life is like after surgery. We're going to talk about some of the top surgery options available today, and we're also going to hit on what I'll refer to as the ugly truth that most doctors don't really want to talk about concerning weight loss surgery. My promise to you then is we're going to get you the skeleton frame or the step-by-step blueprint to weight loss success. So turn off your phone, shut out all your distractions, take good notes, and kind of, just pay attention here. And again, ask questions as they come up. So here you go, a little picture of me. You saw me right at the beginning, but stick with me to the end, and you'll also get access to a very special gift that we've got set up for you to really help you formulate a plan for you, as well as making the decision whether to proceed or not. A little bit about myself then. I've been doing weight loss for a long time, weight loss surgery for over 23 years. I also do medical weight loss. So I've had over 23 years experience as a leading weight loss surgeon. Bariatric means weight loss. I've done nearly 5,000 weight loss procedures. I'm actually board certified in two separate specialties. One is surgery as well as medical weight loss. So we also do medical weight loss. And we have results with our surgery that exceed national averages. Nowadays, if you've looked into weight loss surgery at all, weight loss surgery, we often do them at areas that are hospitals that are referred to as center of excellence. And by the center of excellence, we have to keep careful statistics, and our results routinely exceed national averages there. I'm also a best-selling author. I've written 5 different books. You'll talk about that a little more as we go on, but all of them have to do with weight, weight loss, medical weight loss, surgical weight loss, kind of things to do, kind of figuring out the best way. And we'll talk further about that as we get into this. Also the creator of Weight Management University for Weight Loss Surgery. And this is our comprehensive post-surgical program. The weight loss surgery itself, yep, that's important, but what you do with the weight loss surgery afterwards is even more important. So we're going to kind of outline some of that, but this Weight Management University for Weight Loss Surgery is a 12-month program afterwards that kind of really gets you to optimize your weight loss, and then how do you keep it off long-term? Basically, how do you keep it off forever? We do have a TV station, Doc Weight Loss TV. You can go there anytime and check that out. So we've changed the lives of thousands of people over many years. And again, you're going to meet a few of them here during our time. So here's some pictures of them. These are all our patients. They're not just come off somebody else's website or from some photograph station somewhere. So these are the people who make our job, who make what we do extremely worthwhile. So why we do what we do? Okay. One of the main reasons is because watching our patients transform into healthier, happier people gives meaning to what we do every day, and it's incredible. It truly is amazing. We love helping people focus on what they can do rather than what they can't do. And we're going to love going above and beyond to help you ensure that you're successful for life. Now, here's why this is important. Many studies, and even more recent studies, plus what I've been doing over the last 20 plus years, confirm that weight loss surgery is now extremely safe. People have often worried about, gee, my goodness, can I safely have surgery? The answer is yes. If you can safely undergo a general anesthetic, you can safely have surgery. So weight-related healthcare costs are just skyrocketing. They're higher than they've ever been. They're expected to rise by almost 6% annually. It's only going to get harder, and it's only going to get more costly. So looking at this now can be extremely important. Now, ignoring this only compounds the problems, and it really puts your goals in further and further out of reach. Every week, every month, every year you ignore this, it's only going to be harder and kind of more expensive. And we know we'd like to think that the healthcare overhaul in the US are going to make things much more inexpensive for people. I'll be surprised. Hopefully I will be surprised, but I haven't seen that occur. Now, contrary to popular belief, responsible weight loss surgery with the right doctor is really now as safe as actually having your gallbladder out. Gallbladder surgery is one of the most common operations done in the US. The risk of gallbladder surgery, the risk of someone dying from gallbladder surgery is about 0.3%. The risk of someone dying from weight loss surgery is actually lower than that. It's somewhere between 0.2 and 0.3%. So it's actually potentially a safer operation than one of the most routine procedures done in the United States. Now, weight loss surgery and the right support program and the right doctor shouldn't be seen as a last resort. Health risks rise as your weight increases. So don't think of this, I need to try absolutely everything else. It shouldn't be your first choice, but reality is it shouldn't be the absolute last resort for you. And when you can follow a proven system like ours, I'm not going to say it's impossible, but it's nearly impossible to fail. I have never seen someone not lose weight. And so it's nearly impossible to fail. I wish I could just say, I guarantee you. There are no guarantees in life, but we can make it pretty darn close to that. Now, been doing this a long time, and I have to admit, I have a little confession to make here. Yeah, I've learned a lot over this past 23 years, but one of the things that I've learned is part of what I refer to as the ugly truth. And the ugly truth with weight loss surgery is that many people regain weight after they've initially lost that weight. So often within a couple of years of having surgery, as many as 50% of weight loss surgery patients are now regaining weight. And a significant proportion of those people are going to regain all their weight back. One of the problems is because many surgeons, many physicians, many doctors don't provide that comprehensive follow-up program because it's costly, both in time and in money. So because of the time and the cost, we don't often provide that. And unfortunately, that can be one of the reasons why people don't do as well as they should long-term and aren't able to, one, lose the weight optimally and then keep that weight off. So most doctors, many doctors don't have the experience, they don't have the ability to provide everything you need for that long-term success. So continuing that ugly truth then is that everyone who has weight loss surgery is going to lose weight. I mentioned that earlier. Unfortunately, most people don't have access to the real information that they need to change their habits for ultimate success. Because again, having surgery, you're going to lose weight. But it's how do you optimally lose weight and how do you keep that weight off long term? And this takes significant behavior change, implementing these things that you need to do. And finally, weight loss surgery can be extremely affordable if you know your options. That literally it can be less than $14,000. Weight loss surgery is affordable. It's less than a small car, and it can last you a lifetime. Keep that in mind. Now, one of the biggest things that I've learned over the last 23 plus years of doing these surgeries is that weight loss surgery is a tool. And just like any tool, it can be used correctly or incorrectly. The education of how to do this, how to use this tool correctly, is absolutely critical. Yes, experience matters. Over the years, I've kind of been able to figure out what are the right things that someone needs to do. What are the right dietary changes? What are the activity, exercise, kind of how you change your behavior. So the experience really does matter. The support side matters. Support for anything matters, but support after weight loss surgery is extremely important, and we can provide that for you. All right. Meet one of our patients here. This is Rhonda. Rhonda is an extreme success story. This is before her success stories. But like many of our long-term success stories, she suffered from many medical problems. Lots of different medical problems go along with weight. I've listed a couple of them that she actually suffered. Pre-diabetes, but diabetes itself goes right along with weight. High blood pressure, hypertension, sleep apnea, lipid abnormalities, but their fertility issues, reflux problems, back pain, arthritis. You can dream up many, many different things, lots of different ones. She suffered from some of the more significant ones. And often when talking to people, kind of diabetes, high blood pressure, sleep apnea are some of the most significant ones that are directly related to weight. We control weight. We can get rid of these things. Now, you've met her, but how do we actually measure this? You know, if you step on your scale, you probably have a pretty good idea of, are you overweight? I mean, but one of the things as health providers, as clinicians that we talk about is someone's body mass index. So a way to measure obesity is sometimes referred to as looking at someone's body mass index, or BMI. Well, BMI is just a number. It just takes your height and your weight into consideration. And what it does, it allows us to compare people of different heights, but it also is a way to stratify health risk. The higher someone's body mass index number, the higher their health risk. So it's not just how much you weigh, but somewhat related to your weight. Because someone who, just as an example of that, say you have two people that are both 100 pounds overweight, one's 6 feet tall, one's 5 feet tall. They're both 100 pounds overweight, but the one who's shorter actually has a much higher health risk with that extra 100 pounds. And that'll show up as a higher body mass index number. So it's a way to stratify health risk. And it's also typically one of the first screening points that any insurance company is going to look at when you're considering kind of weight loss surgery. Now, another thing that's very important to keep an eye on, and there are special scales that we use to do this, is looking at body composition. Body composition is looking at what is your body made of, specifically looking at how much is fatty tissue and how much is everything else. The everything else we often refer to as lean body mass. Lean body mass, yes, it's the muscle tissue, but it really means everything that's not fat. It's really important during weight loss to keep an eye on body composition. Well, the main reason is because you want to make sure you're losing fatty tissue, not losing the good stuff. You don't want to be losing that lean body mass. The main reason that's so important is it's your lean body mass that drives your overall metabolism. So if you're losing weight but losing a lot of lean body mass, you're slowing your metabolism down, which is only going to make it harder to keep losing weight. And it's going to make it easier to gain weight or regain weight. And so you really want to make sure you're keeping an eye on body composition, preserving that lean body mass, getting rid of the fatty tissue. And again, we have special scales that you can use to kind of figure that out. But it is an important concept. Now, Rhonda, I mentioned those medical problems that she had, but there are other things that really aren't so easy to measure. And you may be able to kind of relate to this. So secretly felt depressed, afraid, lonely. And it wasn't that she didn't have friends. It was like, no, she had plenty of friends, but kind of feeling lonely, like this is my problem. No control, and kind of that genetic thing. She had multiple family members that actually died early because of the weight and the weight-related problems, from diabetes-related problems to heart problems, all related to their weight. So she felt kind of, I have no control over my genes or my genetics. And that is true. We can't change genetics, at least not at this point, not easily. But there are things we can control. And yes, we actually can improve this, not the genetic side of it, but the kind of the medical problems as that are kind of that genetically you may be prone to. And these things you may actually be able to relate to. So what she really needed to know that there really are proven options out there, and we can help them there with that. So lots of different options. Now, surgery obviously is what mainly we're going to hit on here, but there are other options. Medical weight loss, medications, those are options too. So we talk about any type of options in weight. We really need to think about all of these. And one of the main reasons I like to talk about these is because these options are all complementary to each other. They shouldn't be thought of as competitive. Either I'm doing medical weight loss or I'm doing surgery, because we can use all the tricks from the medical side with the surgery side. From medical weight loss, again, there's lots of different diets out there. You know there's lots of different diets. You've probably tried hundreds of diets out there, but there are lots of different weight diets out there. A diet is just a tool. That's all it is. And it's kind of figuring out the right diet plan. And that's true after surgery, before surgery, and after surgery as well. Same thing with medications. Certain medications you may be on that may affect your weight, which either make you gain weight. We want to try to avoid those, but then also medications that can help with weight loss. And so there are a number of things we can do, and these options are all there. And just because you're picking one or another doesn't mean you should disregard the others, because they actually are complementary to each other and should be thought of as we can use all of these things to help with weight loss. So who then really is a candidate for surgery? And many insurances have their own criteria, okay? And each insurance typically has a little bit different criteria. Most insurances do follow National Institutes of Health recommendations. The National Institutes of Health, a government agency that got together now over 20 years ago, like 23 years ago, and put together this list of criteria that if you meet these criteria, you're a candidate to consider weight loss surgery. Now, They've never been updated, and apparently they aren't going to be updated. But the basics of this, again, most insurance companies follow these criteria, or what the recommendations from the National Institutes of Health. What do they say? Anyone that has a body mass index over 40 is a candidate to consider surgery. Now, body mass index of 40 is around 100 pounds overweight. You could be completely healthy otherwise. You have absolutely no health problems. It's just your weight. But if you have a body mass index of 40 or more, generally you're a candidate to consider surgery. Or if you have a body mass index of 35 or more with medical problems. Now, body mass index of 35 is around 70 pounds overweight. So body mass index of 35 or 70 pounds overweight with medical problems. When I say with medical problems, every insurance company has their own list. They almost all include diabetes, high blood pressure, and sleep apnea. And then they may throw in a few other ones, whether it be, arthritis, back pain, cholesterol problems, those type of things. But they almost all include diabetes, high blood pressure, and sleep apnea. From my perspective, actually, there's getting even more and more evidence in the surgical literature that people that have diabetes, sleep apnea, high blood pressure could actually consider having surgery at even a lower body mass index. Typically, insurance won't cover that, but it is something to consider for those people that are only 50, 60 pounds overweight with a body mass index of 30 to 35. There's more and more evidence out there now showing that this can be a very good, real option. So what are the options then? And we're going to hit some of these options, and we'll talk about the 3 most common options done in the United States. I'll also tell you about what I think is probably a better option for most people. And that's a generalization there. Okay? But the common surgical options in the United States: gastric bypass, it's been around for about 60 years. Adjustable gastric banding, which has been around now in the US since 2001, so coming up in about 14, 15 years. And then an operation called sleeve gastrectomy. Sleeve gastrectomy is kind of more of what I'll call the newer kid on the block. Actually, it's not a new operation. It's a new use for a really old operation. We used to do sleeve gastrectomies for different reasons, not weight loss. Now, and actually after kind of the discovery of a hormone called ghrelin, this has become a weight loss operation. So for the last about 11 years, it's been used as a weight loss operation, and sleeve gastrectomy is the most common operation done in the United States for weight loss. It's probably close to 95% of what I do nowadays for weight loss, because we find such great results with it with fairly low risk. And we're going to be talking about all these things. All right, talk about gastric bypass first, because it's been around for the longest period of time. And gastric bypass, first one was done in like 1955. Okay, but gastric bypass is an operation where we make you a tiny little stomach, and then we bypass the rest of the stomach there. So kind of we make you a tiny little stomach, and hopefully you can see this little pointer. I'm pointing out this tiny little stomach. We utilize the very beginning of the normal stomach to make it, and then subsequently bypass the rest of this stomach here. That's where the name came from, gastric bypass. And we do that by going a short distance downstream in the small intestine. We divide the very beginning of the small intestine. We pull this new end up, and we hook it into that tiny little stomach. And by doing that, then we've bypassed the rest of the stomach and a short portion of the small intestine. And whenever we bypass any of the intestine, there's going to be a component referred to as malabsorption. So gastric bypass actually works 2 different ways. One is it makes you a tiny little stomach, so you can't eat very much. So we refer to that as restriction. You can't eat very much. So the concept is very simple. We have a tiny little stomach, you can't eat very much, you'll lose weight. And then also that malabsorption, and that's where the bypass part comes in. When we bypass any of the intestinal tract, you don't absorb things quite as easily, and subsequently then, because you don't absorb all the calories, you'll lose weight. But there also that becomes potentially problematic, because if you're not absorbing all the calories, but you're also not absorbing some of the micronutrients. So some of the other vitamins, minerals, other micronutrients, which potentially can be problematic long term. Now, gastric bypass, since it's kind of the biggest, if you want to call it the most complex weight loss operation, also tends to have a higher risk for the actual surgery. And so there's a higher risk of, as I mentioned earlier, that weight loss surgery is very safe, but this is going to be the higher risk of death related to that, but it's still very low, but also infections, blood clots, vitamin mineral problems long term. And so we see long term that there are potential problems that develop with gastric bypasses. And those potential problems, especially the vitamin, nutrient, abnormal anatomy problems, never go away. So there's higher risk long term of looking at potential bowel obstructions from scar tissue, bowel obstruction with just abnormal anatomy, the vitamin and mineral problems that we see. And so there are a number of things that are potential problems long term. Having said that, we do see fairly good weight loss with gastric bypasses. The problem I see, and the average weight loss we see with gastric bypass is around 70% of what you are overweight. So if you're 100 pounds overweight, that's 70 pounds. But one of the issues I've had with gastric bypass is between 30 and 50% of people with gastric bypasses regain almost all their weight back, which is why I haven't become so enamored with gastric bypasses, although yes, we see good weight loss with it. Now, second operation I mentioned there was adjustable gastric banding. And adjustable gastric banding is where we place a band, and it's an adjustable thing. It's got a balloon on the inside of this band around the very top of the stomach. And so it makes you this little tiny stomach sitting above the band. So you eat a little bit of food, you get full. And then because we can tighten this band down, we can slow down the emptying of the little stomach, but then food still goes into the rest of the stomach. It'll travel down your intestinal tract normally. It gets digested normally. Now, because we're not dividing anything here, all we're doing is placing the band around it, the risk of that initial surgery is pretty low. And so we often refer to as adjustable gastric banding as the least invasive or the lower risk or most minimally invasive procedure for weight loss. Now, the potential problem there is one, we don't see as good a weight loss. In long term, we see the average weight loss about 45% of what you are overweight. So if you're 100 pounds overweight, 45 pounds. And then we also, again, see significant weight regain really for two reasons. One is if the band doesn't work very well for you, but the second reason is if you begin having problems with the mechanical device. And what we're seeing as time goes on is we're seeing more and more problems with the mechanical device. In the US, we're seeing somewhere between 20 and 40% of people with adjustable bands need their band removed over time. And that's a significant number. So revisional, surgery, needing a significant second surgery, sometimes third surgery to take care of this. And we sometimes see bands slip, where the band slides down the stomach further and gets stuck, or the band could actually cause that stomach to dilate too much above it, which can then kink over the edge of the band, or the band itself can erode into the stomach and subsequently cause problems. All of those are reasons the band would need to be removed. And so at this point in my career, after doing close to 700 of these adjustable bands, I'm not a huge fan of adjustable bands anymore, not because they can't work, their weight loss is okay, but it's really because it's a mechanical device. And over time, we see more and more problems with a mechanical device. Which then leads us to this sleeve gastrectomy. Sleeve gastrectomy is kind of, again, I'll call the newer kid on the block. It's been used as a weight loss operation now for the last 11 years. And what we do here is we remove this part of the stomach that's slightly lighter in color here. So I'm kind of pointing this out on the with my pointer here. We're going to remove this part. So even though it's shown in the picture, that's actually going to be taken out. And it leaves you then with a tubular stomach or sleeve, like a sleeve on a shirt is tubular shape. Sometimes when people hear the word sleeve gastrectomy, they think we're going to place something around the stomach or putting it around the stomach. That's not true. We're not putting anything around the stomach. It's all your normal tissue. We've just made it into a tubular stomach as opposed to a big floppy stomach. But your anatomy is still normal. Everything remains the same, meaning the food still goes through normally. Everything is digested normally. It's just a much smaller stomach. So sleeve gastrectomy removes the stomach's greater curve, or that floppy part of the stomach. It leaves you with a tubular stomach. Nothing is bypassed. There is no malabsorption then, and the anatomy remains normal. It's just a much smaller stomach. Now, since the stomach is much smaller, you can't eat very much. If you're looking for a visual of kind of the size of the stomach, get out the last time you got to the grocery store, look at the medium-sized banana. Basically, that is going to give you a rough estimate of kind of what this smaller stomach is going to look like, kind of the size and shape, about the size and shape of a medium banana. But the other thing that occurs when we take that bigger part of the stomach out, it's that larger part of the stomach that makes that hormone ghrelin. And I'm going to back up one slide here to kind of point that out again. So it's this part of the stomach that we take out, and it's this part that makes that hormone ghrelin. So subsequently, then ghrelin levels go way down. And when ghrelin levels go way down, hunger is much easier to control because ghrelin is a hormone that makes you feel hungry. Ghrelin levels go down, hunger easier to control. Again, the increasingly popular, fastest growing option. This is the most common operation done in the United States for weight loss, and close to 95% now of what I do. Surgery itself doesn't take that long. It takes about 45 minutes. 95% of what we do is outpatients. So people come in, have the surgery done, kind of spend the day at the hospital and go home at the end of the day. So it's actually fairly rare that you even have to spend the night at the hospital. Full recovery, pretty quick. Typically within about 3 to 4 days, you'll be comfortable driving, and full recovery generally in about 2 to 3 weeks, feeling like I can pretty much do whatever I want to. Generally at 3 weeks, you can pretty much do whatever you want to. Okay, so recovery really is very quick with this operation. Now, there's risk with every single operation in the world, and I mentioned some of the risks earlier with the gastric bypasses and adjustable band, but I do want to kind of spend a little bit of time kind of looking at kind of what are the risks with this sleeve gastrectomy. Now, we divide risks, and I think I may have mentioned this earlier, into right around surgery versus long term. Now, by medical definition, right around surgery is often referred to as perioperative, and it actually means within 30 days of the surgery. So obviously, worst case scenario is, could someone die? Well, any big operation, that's not impossible. So risk of death, though, is very low, 0.2%. Probably everything else in it, you're going to get better. Okay, but we still worry about different things. One of the biggest things we worry about after any type of surgery is infection. Right, whether some infection is relatively easy to treat, but probably the most worrisome type of infection, because could you get a leak from that intestine or that part of the stomach where we divided it? The risk, and that literally is a rip-roaring infection. Now, it's also a very fixable problem. You may need to have a second operation to fix that. But the risk of getting a leak from your intestinal tract, once we start dividing your intestinal tract, is generally about 1%. Now, what we see here at the Center for Weight Loss Success is generally about 0.2% as well. So it's very low, but not impossible. Other things we watch for: wound infection means on the skin. Could you get a skin infection? Could you get a blood clot? DVT, PE means deep venous thrombosis or pulmonary embolus. That means blood clots. You can get a blood clot without having surgery. You can get a blood clot from taking a long airplane ride. You can also get a blood clot from getting dehydrated. But can you get a blood clot from having a general anesthetic? So yes, it could happen. If you got a blood clot, you'd have to be on a blood thinner to dissolve that blood clot. Other things we watch for: nausea, vomiting, dehydration. Just says, when we divide that little stomach, we make you this tubular stomach about the size and shape of a medium banana. The first thing that happens to that tissue is it swells up. Just like if you walked outside and sprained your ankle is going to swell up. So when we operate on you, whatever tissue we operated on is going to swell. So subsequently then, you may have to get some extra IV fluids to prevent dehydration and let that rest for a few days, let swelling go down. Long term, one of the things I really like about this operation is once you've healed, and you've got normal anatomy. You just got a much smaller stomach. So one of the things I really like about this is we've gotten rid of a lot of long-term problems with this operation. As I mentioned earlier, with gastric bypass, you got nutritional problems, abnormal anatomy problems that are forever. With adjustable bands, you got device problems. And generally, until that causes a problem, the potential is always there. With a sleeve gastrectomy, once you've healed, you're healed. The thing we do have to keep a little bit in mind is something called stenosis. Stenosis means narrowing. You'll sometimes hear it referred to as stricture. And we're talking about is somewhere along that tubular stomach, again, that size and shape of a medium banana, if somewhere along that tubular stomach, could it actually scar down and get too narrow? Now, the natural history of these little stomachs is they'll slowly dilate a little bit to about meal-sized small plate. But every once in a while, we see someone that'll scar this down. In theory, the risk is about 1%. I've done about 1,000 of these now. I've seen one. But reality is it could happen. If that happened, typically we have you see one of the gastroenterologists. They can take a look down there. They actually use a little balloon and they can actually stretch that out. So it would be even rarer that you'd need more surgery. Not impossible that you'd need more surgery to fix that. But still the long-term risks then are really very minimal. So what results can you expect after weight loss surgery? So as I mentioned there, if you compare the three operations, typically I'll start with adjustable band first. We see about 45. It's about 70%. So if you're 100 pounds overweight, 40, 70 pounds. Now we see pretty much the same weight loss with sleeve gastrectomies without changing your anatomy. And I think the reason that occurs is that ghrelin levels go way down. So what results can you expect with a sleeve gastrectomy? Generally, it's about 70% of what you are overweight. So if you're 100 pounds overweight, losing 70% is losing about 70 pounds. Now that's average. We see people lose a lot more than that. And I've also seen people lose less than that. Yet I've never seen someone not lose weight. Now, I mentioned earlier too that our results exceed national averages. And one of the reasons why that is, it's not that, I mean, I love to say it's all because I do such wonderful surgery. Now, hopefully I do, but it's really because of the support side, the education side. And we want to work with people who are qualified, but also committed to their success. If you're not committed, you shouldn't even be considering doing this. And again, we've developed an exclusive Weight Management University for weight loss surgery, 12-month post-operative program. It actually begins before surgery. So exclusive pre-surgical education classes, 12-month post-operative weight loss surgery program. We literally support you every step of the way. And these things include a lot. Okay, we refer to it as Weight Management University for weight loss surgery. It's kind of a fun thing to develop. We developed it over years and years. With 12 months of Weight Management University for weight loss surgery, there are modules that are literally delivered to your doorstep. So every month we kind of walk you through the year, kind of what do we need to work on the most? What's most important right now? What are the changes that you're going through? Because it is something that evolves over the year. It does give you unlimited access to our membership portal. We have hundreds of teaching videos in there. We have weekly education and fitness classes here. We also do include kind of fitness center membership for those of you who don't live here, that it does include sessions of kind of a personal trainer that we can get lined up for when you come in to see us, and so much more. One of the most important things that it does include isn't actually written on there, and that is every single week I do a live webinar. I refer to it as Losing Weight USA, but you have every single week, you have access to me from wherever you are in the world. With your smartphone, with your computer, we send you an email. It's got a link on there. It connects everybody together. I cover a certain topic. Every single week, it's a different topic. I have like 50 to 55 different topics I rotate through the year. And obviously, we kind of rotate those through. And then subsequently, then you have access to me to ask questions literally every single week. Again, no matter where you are in the world, this gives you access to an expert to help you if you have questions. Nobody else offers anything like this. And yes, we have checked. Now, what really influences success? Okay. So what really influences success? I can't speak. What really influences success after weight loss surgery? Lots of things. Obviously, education and sport, as I mentioned, you have to know what to do, and then it's implementing that. But there are a number of things we're going to work on with you. Certainly, your metabolism, lean body mass, we want you to preserve that. This is going to influence weight. Age influences weight. Medical problems. Now, some medical problems we won't be able to fix, but many of them we can, because many of them are weight related, and some medical problems will actually make it harder to lose weight, and we're going to work on getting those all solved. Gender, ethnicity, medications, a lot of things, again, influence weight. We want to figure out what is kind of holding you back before surgery, after surgery. What different hormones? There are lots of different things. Genetics, we can't change them yet, but kind of figuring out these things that can affect weight are very important. And then we're starting to figure out some things that we do have some real influence on. Stress influences weight. How do you handle stress? This is a huge part of the education process. Activity, exercise, that's kind of obvious. Yes, that is going to influence weight. Carbohydrate addiction. I wrote this carbohydrate sensitivity, but carbohydrate addiction is a real entity. We can't cure it, but we can control that. Environmental toxins, meaning we're exposed to things throughout our lifetime. How does this affect weight? Vitamin nutrient deficiencies are incredibly common, and they do affect weight. We got to figure those out. Food allergies, also incredibly common. They affect weight. Appetite stimulants, things like salt, artificial sweeteners, alcohol. Caffeine actually is one of the biggest culprits. Caffeine can actually affect weight tremendously because it tends to increase stress hormones, which makes us resistant to losing weight. So, does it work? Remember Rhonda we talked to earlier, I looked at earlier? Here's Rhonda now. As she said, I don't have my old life back. I have a better life. And you can do this too. Rhonda lost 100 pounds. She's living that lifestyle. So a little bit of a recap. Today, I promise you're going to learn what you need to qualify for weight loss surgery, discover how weight loss surgery can dramatically improve your health and quality of life. Going to give you some of the truth behind some of the best surgical options available today. I've been doing this a long time. It doesn't do me any good to kind of not give you the truth, and actually to share a plan for you to lose the weight and keep it off for life. Hopefully you've discovered why weight loss surgery works. Long-term success comes from both education and support, and then also implementation too. Right now is probably the best time to realize that weight loss surgery is right for you. Don't put this off. Okay? You may be wondering how you can experience change like this. Another patient, yes, Keisha, sexy diva at a size 20, but now I'm even a healthier sexy diva at size 4. You really owe it to yourself and the people you care about to take charge of your health. Now, whether you know it or not, you're making a decision right now. You may not be aware of that, but what direction you go, and especially if you're thinking, I'm staying where I am now. Because deciding to stay where you are is a choice. And like this photo kind of implicates, is that potentially it can be a prison. But deciding where you are is truly a choice. Not making a decision is a choice. But also so is taking that first step towards the life you deserve. And the conclusion of where these paths lead, so where are you heading? It's time to make that decision there. And as you know, doing this alone is not easy. Many people have tried a lot to do this alone, but doing alone is hard. Weight loss is hard. I've been doing this a long time, and there's not an easy fix. So here's how I can help. And also mention that little, or get back to mentioning that free gift that I talked about earlier. So if you're serious about getting the results you want, My team and I have set aside some time to talk with you personally to customize a weight loss strategy that's right for you. The cost for this session is absolutely free. It's going to cost you a little time, but that's it. Okay. But again, this is not for everyone. If you're not serious, if you're not committed, don't waste your time. It's not worth it. Okay. But here's who we can help. You really need to be absolutely committed to improving your health and feeling your best. Isn't that what you want? You must be able to actively participate in your post-op program, and you really have to be willing to get 100% real and honest about where you are now. Okay, you also want to find out where do you want to be and compare that to where you are now. You must be willing to invest in your own success, and that's time, effort, your own resources, as well as communication. We can't help you if we can't connect with you, but we can help you if you do. So now, if we feel you qualify for one of our programs, there's a good chance we're going to invite you to become one of the few new patients we accept this month. I know that sounds like, gee, we're kind of think it's there aren't very many people, but reality is I can only operate on so many people every month. So there are only so many people we can help every month. So I'd like to say, gee, there are thousands we're going to do. Over time, yes, we will. But there's only so much time in a month. There's only so many people I can help each month. So you must be ready to make the changes necessary. You must be willing to invest in your own success. If that's you, book a call with us now. Now, I'm going to switch over here and I'm going to put, if you want to, you can click on this site, okay? And you can go now to actually work on scheduling your own appointment. So if we work together, we'll collaboratively create a custom plan to reach your weight loss goals. We're going to implement the strategies you heard about today. You will get access to Weight Management University for weight loss surgery. There's going to be, we'll be there as a guide literally every step of the way. And kind of the added benefit, really having a community support, because we put everybody together and we can actually then support you from a community standpoint as well as individually. Again, it gives you weekly access to me. Now, this is only for people who are 100% committed to achieving long-term weight loss success. So if this is you, in less than 6 months, so less than 180 days, you can completely transform your life. This could be you. It could be pain-free out there doing those triathlons. Feel confident in whatever you wear. You really can be all you can be, both for you and literally everyone that you care about. You deserve this. You enjoy the active lifestyle. You can be out there just like Terry, kind of enjoying life once again. So the time is now. You've heard all the options when it comes to weight loss surgery. You've seen how we create massive success for our patients literally every day for the last 23 years. You know that weight loss surgery may be right for you, or you wouldn't be still here on this webinar. I'm sure you have some questions. And if you do, I would encourage you, connect with us. That's what we do. We can answer these questions. Things like cost with and without insurance. When can I return to work, which is pretty quick. I mentioned earlier cost even without insurance. Literally, it's less than $14,000. When can I return to work? Depends on what you do, but it's often, we'll figure it out for you, but it's often within sometimes literally days to just a few weeks. What do the most successful patients do before, during, and after surgery? And we're going to walk you through all these things. So here's what I want you to do now. Go to this site, www.cfwls.com/schedule, and lock in your time for your free consultation. In literally 15 to 20 minutes, we can answer every question and discuss all your options. We can get you started. And if one of our programs is a good fit for you, we can discuss working together for the long term, because it really is a long-term relationship. I mentioned it's got the Weight Management University for Weight Loss Surgery 12-month program, but that's literally still the beginning, because we're talking about lifetime, because we want this to be successful for a lifetime. You have contact with us forever. I'm not going anywhere. We've been here a long time. We're planning on being here a much longer time. Okay. In the meantime, then, remember that free gift I mentioned? Keep an eye on your inbox, because this book will be showing up. Okay. Is Weight Loss Surgery right for me? And it really answers, this book answers one of my bestseller books, but answers the top 21 questions most people ask about weight loss surgery. And it really looks at the questions you need to ask, not just the questions you've thought about, but it's the questions that you really should be asking about weight loss surgery. With this book, we have a comprehensive video library, kind of explains all the different things for you. There's also weight loss tips revealed by our most successful patients within the book. And more, really, it's the perfect primer for our call together. And you get access to all of this literally in the next few hours. So again, watch your inbox. So again, go to this site, cfws.com/schedule. Don't lose your spot. Sign up now. All right, well, I appreciate everyone out there listening to my ramblings. Obviously, hopefully you can tell that this is something I'm very passionate about, and I would love to help you. If you're struggling with your weight, don't hang up and just go about your business. Basically, go to this site, schedule your appointment, and get this set up so that we can help you. I would love to do that for you. Again, thank you all for listening. Hopefully we'll see you in the very near future at the office. Take care, everyone.